Imagine hearing voices no one else can hear, believing in things that feel so real, but no one around you sees. What if your brain couldn't tell what's real and what's not? Welcome to today's deep dive on schizophrenia, one of the most misunderstood mental health conditions in the world. We'll explore the symptoms, early warning signs, causes, and both medical and holistic treatments, along with the latest science that's reshaping how we view this illness. Let's break the stigma and uncover the truth. Schizophrenia is a chronic, severe mental disorder that affects how a person thinks, feels, and behaves. It disrupts reality perception, making everyday life challenging. Key features include hallucinations, delusions, disorganized thinking and behavior, social withdrawal, flat or inappropriate emotions. It usually begins in late adolescence to early adulthood, often between ages 16 and 30. Despite popular myths, schizophrenia does not mean split personality. It's a thought disorder, not a multiple identity condition. Symptoms are categorized into positive, negative, and cognitive symptoms. Positive symptoms, things added to behavior: hallucinations, seeing, hearing, or feeling things that aren't there. Voices are most common. Delusions, strongly held false beliefs. Examples: thinking someone is trying to harm you. Disorganized speech, incoherent or unrelated thoughts. Disorganized or catatonic behavior, unpredictable or abnormal movements. Negative symptoms, things taken away from normal functioning. Flat affect, lack of facial expression or emotional tone. Social withdrawal, anhedonia, inability to feel pleasure, lack of motivation or interest. Avolition. Cognitive symptoms, poor attention, memory difficulties, impaired decision-making, trouble understanding social cues. These symptoms vary in intensity and frequency, often worsening during psychotic episodes and improving during remission. Schizophrenia doesn't have one single cause. It's influenced by a combination of genetics, brain chemistry, and environment. 1. Genetic risk. People with a first-degree relative, parent, or sibling have a 10x higher risk, but it's not guaranteed. Environment plays a role too. Brain chemistry: imbalances in dopamine and glutamate, abnormalities in brain structure, especially in the hippocampus, amygdala, and prefrontal cortex. 3. Environmental triggers: prenatal exposure to infections, malnutrition, or stress. Early childhood trauma, cannabis use during adolescence, high-stress life events can trigger first episode. It's often a perfect storm. Genes load the gun, environment pulls the trigger. Antipsychotic medications are the foundation of treatment. 1. First-generation antipsychotics. Typical example: haloperidol, chlorpromazine. Effective but higher risk of motor side effects. Examples: tremors, rigidity. 2. Second-generation antipsychotics. Atypical examples: risperidone, olanzapine, aripiprazole, clozapine. Fewer motor side effects, better for long-term use. Clozapine is used for treatment-resistant cases. Side effects: weight gain, diabetes risk, drowsiness, sexual dysfunction. Long-acting injectables, LAIs. Monthly or bi-monthly injections help maintain stable medication levels. Great for patients who struggle with daily pill adherence. Medication isn't a cure, but it helps manage symptoms, reduce relapse, and improve quality of life. Medication alone isn't enough. A multidisciplinary approach is key. 1. Cognitive behavioral therapy for psychosis, CBTP, helps patients recognize and reframe delusional thoughts, teaches coping strategies for hallucinations. 2. Psychoeducation. Educating patients and families about schizophrenia reduces relapse by improving understanding and support. 3. Social skills training helps patients navigate social situations, improve communication, and rebuild confidence. 4. Family therapy reduces stress and miscommunication, encourages stability in the home. 5. Occupational therapy rebuilds routines and helps regain independence, supports return to school or work. 6. Lifestyle and self-care, stable sleep schedule, healthy diet, low stimulation environments during flare-ups. Avoiding substances like alcohol and cannabis. Recovery is not linear, and relapses can occur, but early intervention and consistent support greatly improve outcomes. Modern science is changing how we approach schizophrenia. 1. Precision psychiatry, using brain imaging and genetic data to personalize treatment plans. 2. Digital monitoring tools. Smartphone apps track behavior, speech, and mood to predict relapses early. 3. Inflammation and immune response. New studies show immune system dysfunction may play a role. Anti-inflammatory therapies are being explored as add-ons. 4. Psychedelic research, with caution. Small trials using psilocybin and ketamine show promise for related symptoms like depression, but not first-line treatments for schizophrenia. 5. Virtual reality therapy, emerging tech to simulate social settings and practice real-time responses. Schizophrenia is complex, yes, but it is not a life sentence. With the right treatment, support, and understanding, people with schizophrenia can live meaningful, connected, and independent lives. It's time to replace fear with facts, judgment with empathy, and silence with awareness. If this video helped you understand schizophrenia better, please like, subscribe, and share this to break the stigma. Drop a comment if you've been affected by schizophrenia as a patient, family member, or friend. Your voice matters.